introduce to you Professor Renée Blaauw, who's a professor in therapeutic nutrition at the Division of Human Nutrition, Stellenbosch University, South Africa. I'm also privileged to know her very well as a colleague and friend, so it's nice to listen to you this evening, Renée. She is a registered dietitian with the Health Professions Council of South Africa. She's the past chairperson of the Professional Board for Dietetics in South Africa, a past president of the South African Society for Parenteral and Enteral Nutrition, or SASPN, and an honorary member of both SASPN and the Association for Dietetics in South Africa. She's actively involved in teaching and training in dietetics with a passion for mentoring. She strives to fulfill her educational philosophy to stimulate, create interest, and empower others to help themselves. Her main research interests include nutrition support of critically ill patients, hospital malnutrition, and nutritional management of gastrointestinal diseases. Renée, we look forward to your presentation on Not All Fats Are the Same, with special reference to dairy and cardiovascular disease.
Thank you for the kind introduction and the invitation to be part of this exciting discussion. Not all fats are the same. I'm going to talk about the use of dairy with reference to cardiovascular disease. The components that I will address will be briefly the prevalence of non-communicable diseases, cardiometabolic risk factors, consensus dietary recommendations, and where does dietary patterns fit into all of this. We'll then investigate some evidence and try to make sense of all of this before we end up with some concluding remarks. If we look at the burden of disease in South Africa, and we specifically use this document from the National Department of Health, then we'll see that non-communicable diseases amount for about 51% of all the disease burdens in the country. Of those, the biggest would be cardiovascular and cerebrovascular diseases, and some of them come from cancer, as well as diabetes and chronic kidney disease. If we look at the document from the Western Cape Province Burden of Disease Report from 2019. And on this slide, you will see three lines. The one indicates stats from 2018, 2013, and 2016. And you'll see that throughout this basically 10-year period, that's been a gradual increase in the prevalence of non-communicable diseases over the course of time in both men as well as in women. If we look at the cardiometabolic risk factors, so the components which we should basically address in order to try and prevent or curb this problem, then you'll notice that it is really a huge number of risk factors. Dyslipidemia, raised LDL cholesterol, a decrease in HDL cholesterol, and an increase in triglycerides on the one hand. In the middle block, you'll see glucose intolerance or insulin resistance. You'll note some form of pro-inflammatory state, hypertension, vascular dysfunction or impaired coagulation. And then on the right-hand side, the lifestyle-related factors. This includes obesity, inactivity, smoking, alcohol, and underlying an unhealthy diet. Of all of these risk factors, the one that's been targeted as the one to try and decrease and focus on is the raised LDL cholesterol. So the assumption is that if we can decrease, or if we can focus on the total fat intake of the diet, specifically on the saturated fat intake of the diet, we can try and see if that can have an effect on LDL cholesterol. And we know increasing total fat, increasing saturated fat does increase LDL cholesterol. We also know that a raise in LDL cholesterol does increase the risk for cardiovascular disease. Therefore, the assumption, if we decrease saturated fat, total fat, we might be able to curb this problem. This was the basis on which most of the international dietary guidelines for the prevention of this problem was actually based on. So control dietary fat intake, and specifically with regards to saturated fatty acid, decrease it to less than 10% of the total energy intake. Nowadays, as you know, we use healthy dietary patterns, or we talk more about dietary patterns or groupings instead of using individual foods or nutrients. Now, if we look at an example of a healthy dietary pattern. And on the slide, you'll see that it contains a higher intake of fruit, veg, whole grains, low-fat or non-fat dairy, seafoods, nuts, and legumes, and then a moderate intake of alcohol and the red meats. But the focus here is on low-fat or non-fat dairy. For the South African guidelines, this is the 2018 updated version of our South African dyslipidemia guidelines. They state that the healthy diet is one of moderation, that is nutrient dense, and it emphasizes fruit, veg, whole grains, legumes, nuts. And then it limits the consumption of refined grains, processed foods, sodium and sugar, and saturated and trans fats. You'll note that it is more vague in terms of limiting saturated fat and trans fats, and it does not specifically mention dairy as a food group in how to address this problem. So if we look at some of the evidence regarding dairy and cardiovascular. So what I've said to you previously is that the international guidelines were based on the assumption that if we decrease fat, specifically saturated fat, we might be able to decrease the increase in the LDL cholesterol, which ultimately could decrease in cardiovascular disease. But does this affect all fats? And specifically, if we use dairy as the example, what does the evidence tell us? This study was done specifically on cheese consumption and the risk for cardiovascular disease. And collectively, they've included the results from 15 different studies, and the mean duration of intake was 10 years. So it's quite an extensive study that was done. And they looked at the effect of cheese consumption on the risk for NCDs, cardiovascular, coronary heart disease, as well as stroke. If you look at cardiovascular disease in the cartoon on the right-hand side, you will note that the relative risk to develop cardiovascular disease, if you compare the highest intake cheese consumptions with the lowest intakes, the relative risk decreased by 10%. For coronary heart disease, it was 14% reduction, and for stroke, again, it was a 10% risk reduction. So the authors of this study say that this talks to the protective effect of cheese when it comes to risk for coronary heart disease. Another fairly recent systematic review that was performed where they included 27 different studies. And this was all studies published until the period of 2014. And they looked at the relationship between total dairy intake and cardiovascular disease. On the left-hand side, you have the cartoon that indicates cardiovascular events. On the right-hand side, it indicates events for stroke. And in both cases, they've got incidence as well as mortality, and collectively they talk about the events, which is indicated at the bottom. So for cardiovascular events, over a course of time, dairy intake decreased the reduction by 10%, and for stroke, dairy intake decreased the reduction or the stroke incidence by 12%. So again, showing the inverse association between total dairy, cardiovascular disease, and stroke. So basically talking about the protective role of dairy yet again. This highly impressive study was published fairly recently. It includes data that was published in the general domain up until April of last year, and collectively it talks about 37 different meta-analyses that was included in this database. It's a massive piece of work. And in this systematic review, they address all the various components of dairy foods. So here you have an example of what the tables look like. And obviously the detail is too much to project on the slide. But if you note at the top, they have 3 columns. The left column indicates a neutral relationship. The middle column indicates an inverse relationship. That means risk reduction. And on the right-hand side, we have a positive relationship. That means risk increase. So for milk intake, which is the first one, you will note that basically all of the slides fall in the category of a neutral relationship. If we move to, or maybe just before we move on, here just note that on the right-hand side for risk increase, there's nothing, which indicates that there's no evidence associated with any form of harm. If we look at fermented foods, you'll note that basically all of the studies are either neutral or protective, so a risk reduction. If we then move to cheese, there you'll again note quite a few studies on the left-hand side, which indicates a neutral reduction, but you'll also note more activity in the middle, which indicates the protective effect of cheese, which alludes to also what I've mentioned previously. But then you'll also note that there are a dose response component that comes in, talking about a 10 grams per day, a 20 grams per day, and a 50 grams per day, and a risk reduction. And I'll come back to that when we talk about the dose response effect. So we started off by saying that the international guidelines were basically based on the premise that if we reduce fat intake, specifically saturated fat intake, we might decrease LDL cholesterol and ultimately decrease the risk for cardiovascular disease. The evidence that I've shown you, specifically using dairy as the example, did not show that. It basically showed the opposite. It showed that dairy, which we know is very high in fat, actually has an opposite effect and a protective effect. So why is this? And I'm just going to talk through 6 potential explanations or examples to try and make sense of all of this. The first talks to the food matrix, and we've already heard about this food matrix. And let's take cheese as an example and unpack the nutrient composition or the nutrient matrix of cheese. So yes, it is high in fat. And yes, 60% of the fatty acid composition in cheese is saturated fatty acids. So the logical assumption would be cut out cheese, specifically the high fat ones, and you will end up with a positive outcome. And I've shown you the opposite to be true. Why is that the case? And that is because of all the other nutrients that's also packed into dairy, and in this case, specifically the example of cheese. Each of these individual nutrient compositions directly impact on one or more of the cardiometabolic risk factors. So either individually or in a synergistic collective effect, they address dyslipidemia, glucose intolerance, or increasing insulin resistance, definitely have an anti-inflammatory impact. They affect vascular dysfunction, clearly obesity through the satiety effect, clearly hypertension. Indirectly, you could also say that they could address inactivity, smoking, and alcohol, not by saying that eating a piece of cheese will cause or will result in smoking less, but evidence is very clear that the moment people start to think more about their diets and about what they eat, it also impacts on their lifestyle and it results in a more healthy lifestyle. Let's look at particle size. Saturated fat, 60% of that we find in dairy. It does result in an increase in LDL cholesterol. That is a fact. However, the size of the LDL particle differs. And in this case, it results in the formation of large LDL particles, not in the smaller, dense LDL particles that you'll find with other fats. These larger particles are less atherogenic and clearly also not linked to cardiovascular disease, and probably because they have a higher affinity for the LDL receptor and they are less susceptible to oxidation. So if we only measure LDL content in the blood, yes, it will be raised. But if we look at the actual particle size, we'll note that it's the larger particles, which could be one of the explanations why we find the opposite effect of what was expected. This is a relatively busy slide, but the message that I want to bring across is that when we read the literature and when we try and understand the various findings, we should also look at what the comparators are. So whenever there's 2 different groups, how do they compare the one with the other? So in this study, they replaced 5% of energy from dairy fat with an equivalent energy source from another source. So remember, dairy fat is animal fat. So if you replace that with 5% vegetable fat, they found a 10% risk reduction. Makes sense. You exclude animal and you convert it to vegetable fat. If it was replaced with a polyunsaturated fat, omega-6, 24% risk reduction, and replaced with carbohydrates, specifically your whole grains, 28% reduction. So this makes sense. But I want you to look to the right-hand side. If you replace 5% of dairy fat, which is an animal fat, with another 5% of another animal fat, there's actually an increased risk for coronary vascular disease. So again, not all fats are the same, not all fats respond the same in the body. The prevalence of inflammation or low-grade inflammation could be another reason that we have to investigate to try and understand why do these things not necessarily follow the anticipated outcome. So we know that all of the chronic diseases of lifestyle have an underlying low-grade inflammation. Secondly, we know that the saturated fats in dairy have pro-inflammatory effects. So again, one would assume that there would be that direct association between dairy intake and inflammation. However, intake of dairy leads to reduction in all of the parameters indicating inflammation, C-reactive protein, tumor necrosis, interleukins, all of them. And it actually speaks to either a neutral or even an anti-inflammatory effect. And this was confirmed by a very recent systematic review of 16 different studies where they investigated healthy individuals as well as those with metabolic syndrome and type 2 diabetes. And they determined the effect of dairy intake on inflammatory markers. And they found no pro-inflammatory effect associated with the consumption of milk or dairy, and even a weak or sort of anti-inflammatory effect over a long-term intake. Second to last is the role of fermentation. So yet again, fermentation can directly impact on reducing inflammation. So platelet activating factor is a pro-inflammatory phospholipid. And we know that dairy contains platelet activating factor inhibitors. And as the level of fermentation increases, this platelet activating factor inhibitor activity increases. So the more fermented dairy products, the bigger the anti-inflammatory effect. I've already spoke about this unique nutrient blend that we have in fermented products, for instance, cheese, and about the synergistic or the collective effect. And then lastly, they're just talking about bacterial fermentation. So we know bacterial fermentation results in the production of short-chain fatty acids, specifically butyrate, and they are linked with a host of positive health benefits, not just improving localized gut health, but also regulating cholesterol metabolism, regulating appetite, and clearly proven anti-inflammatory properties. So lastly, then back to the dose-response effect. We've shown that with cheese intake, there's a nonlinear association and nonlinear inverse association between the intake of cheese and the risk for cardiovascular disease. And in this specific study, the largest risk reductions occurred at a consumption of about 40 grams of cheese per day. Back to the systematic review that I referred to earlier, and I mentioned to you that the various portion sizes indicated a specific risk reduction. 10-gram portion size a day, 2% risk reduction. 20 gram, 4%, and a 50-gram portion per day resulted in a 10 to 14% risk reduction. So the greater portion, the greater the risk reduction that they found in this very impressive study. To put this into concept, so a 20-gram portion of grated cheese is about the size of a tablespoon, whereas a 50-gram portion of grated cheese is about the size of a serving spoon, or you could say it's about a third of a cup grated cheese. So that gives you an indication of the portion size. So this study then continues, and they basically summarizes to say that in healthy individuals with a normal serum cholesterol, they recommend a total dairy intake, whether it's full fat or low fat, of up to 200 grams per day. For milk intake, the recommendation is up to 200 ml a day. So that's basically a good glass of milk per day. For yogurt, the recommendation is up to 200 grams. So it's basically 2 of the smaller tubs. And for cheese, as mentioned, the recommendation is up to 50 grams per day. So lastly, just looking at the global nutrition report and trying to understand the food intake globally. Now, again, very busy slide, but you can focus on the yellow bars, which are the bottom bars on all of these graphs. So at the bottom, they have the various continents. The African continent is the second set of bars where they compare the 2010 data to the 2018 data. And then Europe, you'll find sort of more or less in the middle of the slide. And then, as I've said, the dairy is indicated by the yellow at the bottom. And the y-axis indicates the food intake per person in gram per day. And on average, globally, the intake of dairy has decreased by about 7% over the course of this 8-year period that they portray the data. But for the African continent, you'll note that on average, the dairy consumption per person per day was about 100 grams. In the case of this specific study, they used the dairy as milk equivalent, so 100 grams, which is half of the recommended values that we've just looked on at the previous slide. So to conclude, the intake of dairy products provide different results from what we expect. And it most probably has to do with the fat content and specifically the source of dairy and this absolutely unique food matrix with the synergistic effects of all of the nutrients. Total dairy intake as a risk factor for cardiovascular disease seem to have either a protective effect or a neutral effect, but clearly no harmful effects have been shown. And the focus on the guidelines to have low evidenced dairy intake is just not evidence-based, because there's no proof that the low-fat dairy intake within the recommended intake levels is harmful. And I would like to use the conclusion of this specific systematic review as the last word, because I believe that they really summarize the literature quite nicely. And they say the results indicate that the association of dairy with cardiovascular disease is largely driven by the food type, cheese, yogurt, milk, and these findings may inform dietary recommendations for cardiovascular disease prevention by allowing healthy individuals with a normal plasma cholesterol a more liberal consumption of up to 200 grams per day of total dairy. And then also they say irrespective, again, of the fat content. Within this amount of consumption, fermented dairy products should be preferred, and they recommend a generous serving of yogurt per day or 3 small servings per week of cheese. I thank you for your attention.
Thank you so much, Renee. We've had a lot of interest in your presentation, and I mean, even I have really a couple of questions that I'd like to ask, because it's been an absolutely really thought-provoking presentation. So thank you so much for that. I'm going to start with a question that's about the recommendation that you made. You said that the recommendation for dairy intake applies to healthy individuals with a normal serum cholesterol. What about those with raised cholesterol levels?
I can give you the short answer or the long answer. The short answer is, I don't know. So to go to the long answer, I think it's because, I mean, I referred to the specific systematic review, and it was their recommendation, and all of the studies that we have in the literature were actually done on their healthy population. So we cannot necessarily just infer and assume that the data can move forward from their healthy to maybe the person with high cholesterol. But I would think, also listening to Prof. Arne's talk just now, there is no one message. I think for me that is the daunting task of being a dietitian in this day and age, but also the exciting task is the fact that we have to be able to adapt personalized nutrition according to our patients. So I would say, given the fact that we don't have a consensus document like we have for the one that I've alluded to, for the patients with high cholesterol and maybe all the other associated comorbidities, in that case, you have to probably just take a step back and ask yourself, well, you know, what are the other risk factors? What are the other problems? Most likely also taking into consideration that the patient might be overweight, and then you might want to look at the total energy content of your diet, start playing with not just the fat, but also bringing in low GI carbohydrates, etc. So I would think, definitely still consuming dairy, because I mean that is a given, and with all the massive nutritional benefits of dairy, we should continue to consume that. but maybe play around with low fat, in some cases higher fat, combine it with fiber, combine it with low GI, and test it out and see how the patient actually responds.
Thank you, Renée. Now, I've got a number of other questions. I'm going to mention them to you, and then we're looking forward to hearing what you have to say. There was a question at the end of Renée's presentation that I do want to ask you as well, that we didn't answer, we didn't actually ask at that stage, but it's very relevant to what you've presented as well. And that is, what is your opinion on meat fat? So high fat in terms of meat, and lean meat in this context of saturated fat?
Mm-hmm. Again, quite a difficult one to give a yes, no, answer. If you recall the one slide that I've shown where they looked at various comparators, where if you take away 5% of dairy fat and you use 5% of total energy from another source, then you get a different specific outcome. In that specific study where they've changed dairy fat to a 5% equivalent animal fat, they found an increased risk for cardiovascular disease. However, they did not specify whether it was lean meat, whether it was this or it was that. They just grouped it as animal fat. So it is difficult to directly answer to say that all animal fat, if that is the alternative, would have the same effect. But based on that study, that was the case. So I think my best response would be, again, and I'm going to use one of the words that Arne used in his presentation. He talked about the magic of food, and I really like that word, because again, it just shows due to the unique food matrix, different foods have different food matrices. They respond differently, and we should not be scared to play around. And I mean, it's all in portion size in any case. I mean, we're not talking low fat, high fat meat, 600 gram portions. We're talking still relevant recommended portions. So I would think, and I'm talking on his behalf, but I would think, based on also on the evidence that he's shown to us, that it is fine, that it is acceptable, that the evidence is there to show that it has protective effects. But just look at the bigger picture and look at the total diet, and not just at a single nutrient.
Okay, thank you. I'm thinking again of ETSA's logo of a couple of years ago that said all foods can fit. So if your whole diet consists of meat, it's not a healthy diet, but it doesn't mean that meat can't be consumed at all. Renée, we've had a very interesting question here that's asking about the difference between the intake of long life versus fresh milk products. If there's a difference.
I have to say, I don't know. In none of the systematic reviews or studies that I've looked at that they specify in terms of the shelf life. They specify it in terms of higher fat, lower fat, fermentation products, etc. But none of the categories were specifically for in terms of shelf life. So I actually cannot really answer that one. I would think that it has more to do with the fat content, with the I don't think the shelf life. I might be totally wrong, so I don't know. And maybe our colleagues from Rediscover Dairy can on their website provide it if I'm totally wrong with this one.
I think that's a very good suggestion, and I'm going to really, we do have the person that's asked the question, and we're going to ask our colleagues from Milk SA just to reply to that as well, because I think we work with it every day. There's another question that is about the percentage of energy from the macronutrients. So we mentioned that percentage of energy can go as low as 30% of total energy for carbohydrate, and then 35% fat. So the person is asking, is that 35% protein then, if you're working towards 100%? So perhaps just looking at the macronutrient distribution
Yes. Yes, I think I don't. Yeah, I think the percentages that were given were mixed up a little bit. So normally, what we look at when we talk about low carbohydrate, that it can go down to about 40% of carbohydrate, which then means that the fat normally goes up to about 35 to 40%, which means for your protein you still remain with about 20% of protein. On the other hand, if you have a carb, which can be anything up to 60–65%, your protein remains plus minus 20, and then your fat becomes the balance, which is the small percentage. Yeah. So when you talk about the low carb and the lower fat, then that was actually the two opposites, and then you have to look at what is the rest of the composition to make up your 100. So your protein in basically all of the studies that I've seen, and it's throughout with diabetes and all of that, it's very, very, very seldom that you should exceed 20% of your total energy for protein.
So now, I think this question was asked before you started describing the portion size. So you did include that in your presentation, but there is a second component to the question. So I am going to ask it from you or to you. They say, what is the total dairy intake included in terms of milk, yogurt, cheese? Was it low fat or high fat?
Okay, it was all. So the recommendation. I know that you were not able to see the detail on the slides because, as I said, the tables were fairly busy. But for instance, that one table that I had with milk, it had high fat milk, low fat milk, total milk, all of them underneath each other in the various categories, and they all fell in that specific case of milk, for instance, in the neutral column. So for the cheese and for the fermented products, they were all lumped together. So they did not make any distinction between high fat and low fat when they made those recommendations, and that's why also in that summary section that I borrowed from this article, because I really like their wording. They specifically say it does not matter whether it is higher fat or low fat, as long as it's dairy with quantities of up to 200 grams per day, as I've mentioned.
Thank you. Right, then our last question is a very simple one that says, what about butter?
So butter is obviously, as you heard, not myself or Anne actually discussed butter, because strictly speaking, it's sort of a slightly different category for dairy. So I'm not going to go into the butter at this point in time, because it has a slightly different impact and different studies, and it was not part of the dairy ambit that I studied for this specific one.
Yeah, I suppose I've also, in the studies that I've seen, very seldom do they refer to butter as a dairy food or ice cream or any of those kind of foods that do have dairy components that have a much higher, content of a certain macronutrient like the fat in butter
100%.
and even in ice cream as well. So I think that's a little bit different. Okay, but thank you also for touching on the fermented dairy products, because I think that's an important component. And again, there the carbohydrate element is important when we're looking at the probiotics that need the prebiotics. And we also know about the important function of lactose as a prebiotic in milk and in enhancing health as well, with a lot of positive effects as well. Okay, I'm just going to, I see someone's asked about cream now, it's just come up. And I think cream falls in the same category as butter and ice cream or something like that would fall. Would you want to add anything about cream, Renée?
No, I think, no, it's definitely in the same category. So it was, it's not part of any of the systematic reviews done on dairy foods per se. You will not find those categories. So it will be individual studies that were done with those.
Okay, thank you very much.